Hello dear viewers, in this video I am going to discuss about shock index, its usefulness and when and why to use this index along with limitation of its use. I am Dr. Sunil Garg from Essentials of Acute Care. Shock index is defined as the heart rate divided by the systolic blood pressure. This is a more sensitive quotient for circulatory shock than vital signs alone, and it is designed to improve detection of severe circulatory collapse in the setting of hypovolemic medical patients. Normal shock index is 0.5 to 0.7. It is important to understand that shock index should not be used to diagnose or rule out critical illness in isolation. How shock index is calculated? As it is derived by dividing heart rate by systolic blood pressure in millimeter of mercury. Let it understand by an example. If heart rate is 110 and systolic blood pressure is 90 mm of mercury, then the shock index is 110 divided by 90 and it will be equivalent to 1.22. In this condition, shock index is 1.22. 0.5 to 0.7 is believed to be a normal shock index. Higher numbers have been shown to be more sensitive than vital signs alone in diagnosing occult shock, need for transfusion and or operation. When shock index is used, firstly, it is used to identify patients at increased risk for transfusion who presents with hemorrhage or trauma. It is also used to identify patients at risk of post-intubation hypotension. Lastly, it can also be used to identify patients at risk of sepsis if infection is confirmed or highly likely. Why shock index should be used or what is its need? Firstly, blood pressure and heart rate when used individually fail to accurately predict the severity of hypovolemia and shock in major trauma. Secondly, identifying patient at risk for massive transfusion can be difficult, and objective measures like the shock index can help as massive transfusion is not safe if not done on the right patient. And lastly, it has been shown to be more sensitive than the ABC score for massive transfusion. Regarding its limitation, the most important limitation of its use is that there are no prospective trials validating its use in clinical practice, limiting definitive conclusion that can be reached based on the current level of evidence. As we can see here, as the value of shock index increases, the degree of the shock worsens and the need of the transfusion and the mortality increases. The degree of shock is categorized based on value of shock index into no shock, mild shock, moderate shock and severe shock with values ranging from less than 0.6, more than 0.6 to less than 1, 1 to less than 1.4 and 1.4 or more respectively. So to summarize, higher values of shock index than normal are more sensitive in the detection of occult shock, transfusion requirement and post-intubation hypotension than either vital signs means heart rate and blood pressure alone in isolation. The role of shock index continues to function as another tool in the resuscitation of sick medical and trauma patient despite its current limitations, and it should be used in conjunction with vital signs and other markers in the clinical decision making of the patient at risk for outcomes like hospital or ICU admission, shock and mortality. Here I finish. Thanks for watching this video. If you have any feedback, suggestions or comments, please write down in comment section. Or if you want me to prepare a video on any specific acute care topic, please share your thoughts with me. I will be happy to assist. See you in my next video. Till then, bye and take care.